My name is Mike Devinney, and I'm an assistant professor and anesthesiologist and critical care physician at Duke University. My research group focuses on discovering mechanisms and risk factors for postoperative delirium. Postoperative delirium occurs in up to 40% of the 19 million older adults that undergo surgery in the United States each year. It is associated with greater one-year postoperative mortality and greater risk for dementia. Yet we have no therapies to prevent delirium, potentially because we don't understand its underlying mechanisms. We aim to find these mechanisms, and we hypothesize that one mechanism underlying delirium is blood-brain barrier dysfunction following surgery. To better understand this, we performed lumbar punctures in 207 older non-cardiac surgery patients, both before surgery and 24 hours after surgery. We then measured measurement that reflects blood-brain barrier dysfunction, the cerebrospinal fluid to plasma albumin ratio. We found that postoperative increases in the cerebrospinal fluid to plasma albumin ratio were associated with greater delirium rates. This remained true even after adjusting for a strong delirium risk factor, baseline cognitive impairment, and after adjusting for age and surgery type. Thus, we believe that postoperative blood-brain barrier breakdown is a precipitating factor involved in postoperative delirium. So baseline cognitive impairment can preoperatively increase your risk, and then having greater blood-brain barrier dysfunction is another way that you can increase your risk or lead to delirium. And the next steps are to test interventions that protect the blood-brain barrier. However, no interventions currently exist. So we will first examine our data set of 207 older non-cardiac surgery patients to identify factors associated with blood-brain barrier dysfunction, such as pre-existing comorbidities like sleep apnea or other sleep disorders, and intraoperative events like hypotension. If we find some factors associated with postoperative blood-brain barrier dysfunction, we can then test these in a future randomized controlled trial.